My name is Carrie Randabolio. I'm Provincial Coordinator Knowledge Mobilization here at the Alzheimer's Society of BC. And I'm also joined by my colleagues, Sarah Wu, who's Strategic Lead of Research, as well as Carol Oliveira, who is our Research and Knowledge Mobilization Program Assistant through the UBC Arts Co-op program. So it's my absolute pleasure to introduce our guest presenters today, Dr. Mariko Sakamoto and Lynn Jackson. Dr. Mariko Sakamoto is an assistant professor at the School of Nursing at the University of Victoria. Mariko specializes in dementia-related and community-based participatory research. Her work has brought attention to the challenging issues and transitions that older people and people living with dementia experience in our healthcare system and Canadian society. Lynn Jackson began her career as a registered nurse. After being diagnosed with frontotemporal dementia, Lynn's interests now include advocating for people with dementia and increasing awareness of Alzheimer's disease and related dementias. She's spoken locally, nationally, and internationally in an effort to promote better diagnosis, access to treatment, and inclusiveness. In this presentation, Mariko and Lynn will explore what meaningful community support entails, focusing on the facilitators and challenges in creating truly inclusive, dementia-friendly spaces. This session bridges past webinars by spotlighting two key initiatives, the Dementia Friendly Communities Action Plan and the Audio Diaries project. Both projects highlight the importance of collaboration with people with lived experience. So I'm going to stop sharing my screen and turn it over to Mariko. Thank you.
Thank you for that introduction, Carrie. As Carrie said, we're going to be talking about two different projects. But before we get to that, I thought maybe you'd appreciate a bit of an introduction that's a little bit more personal, because often, when we talk about research, it can get kind of stuffy. And really what this work is about connecting with people and learning from people with lived experience. So Lynn and I just wanted to take a quick opportunity to share a little bit about ourselves. And so, as Carrie said, I do work at the University of Victoria, and I started here 2 years ago in an academic position. But I am a longtime nurse. I've been a nurse since 1998, and most of my career has been in the community setting, where I've worked mostly over the years, worked a lot with older adults and a lot of people living with dementia. So that's kind of where my interest in this work started. Um, and in my daily life, I travel a lot between Victoria and Vancouver. So this picture you see on the slide here is of my commute. So I was on this ferry this morning, going through Active Pass. And so given that I kind of go in between two places and the work that we do is all over the province, I really want to acknowledge the territories that I am so lucky to kind of go back and forth between. So here in UVic, we are on the traditional territories of the Lekwungen peoples. So that's land that has historical relationships with the Songhees, the Esquimalt, and the Salish peoples. And when I'm in Vancouver, I'm really grateful to be living on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And the projects that we're talking about, as I mentioned, are from all over BC. So they were conducted across the traditional and unceded territories of many different Indigenous peoples and their lands. Um, so having said that, I'll just turn it over to Lynn to say a personal hello to everyone.
Hi there. As Carrie said, I was a registered nurse also for many years, working in emergency, and then I went into the business side of medicine and sold coronary angioplasty equipment in Mexico and Latin America before I became ill and had to come back to Canada to well, because of not being able to live on my own, and got involved with the Alzheimer's Society and other people, and became a passionate advocate for people who are diagnosed with mostly the early stages of dementia. And I've taken my most interested is in the stigma that's associated with dementia. Yeah. Thank you.
Thanks, Lynn. And I always think it's pretty cool when we work together because we're two nurses, because nurses always love hanging out with other nurses, I'll tell you that. So what Lynn and I are going to be talking about are, as I mentioned, our two projects, but really they're part of a program of research that I've been working on here at UVic, where I often get to work with Lynn, which is wonderful. Um, but really the overall kind of theme of my program of research is co-creating age and dementia inclusive communities. So what that really means is that I'm really interested in exploring possibilities in the work that I want to engage in, where there's partnership with people with lived experience. So, of course, that means people who have a diagnosis of dementia or are living with a condition that affects them in terms of their cognition or the memory. And I want to collaborate with them to do research that's meaningful and that's going to make a difference in people's lives. Um, and I also work closely with care partners and caregivers of folks living with dementia. The work that I'm interested in also often has an action-oriented focus. So, any research will say that, of course. But what really gets me excited is when we engage in work from the very beginning of a project um, with people with lived experience, so that all along the way they have a say in the work that we're doing, and that we can focus together on creating some type of outcome in terms of what we do with the findings that comes out of the work we do together, that comes out of the research that we engage in together. And I'm also really interested in the shifting of power in terms of, when we think about really traditional research where the researcher has a lot of power in the decision making, when you work closely with people in partnership, that changes in really interesting and exciting ways. And maybe this is from my interests and experience as a nurse, but it's about building relationships with people um, and learning from them, and when we engage in research in that way, really, I think really cool things can happen. And hopefully you'll find something interesting in the projects that we're going to be talking about. And so words that I use a lot are things like co-creating, co-designing, and co-researching. And that really came out of work that I did just after I finished my PhD. So as I mentioned, I was a nurse for a long time, and then I went back to school, never thinking I would end up doing research. But somehow that happened. Somehow I managed to finish my PhD. And when I finished that, I had an opportunity to get some experience working on a project called the Flipping Stigma Project. And some of you might have heard of this project or the website that came out of this work, which is called Flipping Stigma um, on its ear toolkit. And you can find that at flippingstigma.com. And it's a project that Lynn and I actually worked on together. You can see in this photo here, this is one of our in-person gatherings. Um, Most of the work on this project occurred during COVID. So a lot of the work we did together was on Zoom, but this was just a few years ago when restrictions had finally loosened up and we were able to gather together. And there were folks from all over the province who were members of an action group. So there's that word again that I mentioned earlier, this idea of action. So this group of people living with dementia came together with researchers like myself, and together we wanted to really address stigma and the discrimination that people living with dementia unfortunately can experience quite frequently. And together we created this toolkit. Um, so I thought this would be a nice way to start off in terms of providing an example of research that inspires the work that we're doing in some of the projects that we're going to talk about. And I don't know, Lynn, if there's anything you wanted to add.
Yeah, I just wanted to say that, I've been involved with a lot of projects, and this one, I have to say, is the one that is um, one of the most important project, if not the most important project I've ever done, and that I feel that it's going to reach the most people and help the most people. As you say, we started it, well, we started it a few months before COVID, and then COVID hit, and actually that was one of the silver linings actually that came out of COVID, because we needed something to do. We wanted to stay active and together, and instead of meeting in person once a month, we were able to meet by Zoom every 2 weeks and really got the work done. And I have to say that we got it done because we had researchers working with us, people diagnosed who were asking the right questions. And through all that, we were able to make the toolkit, and the toolkit is actually on the WHO's website on one of their platforms. So I think that will make it accessible to an awful lot of people, especially since we're going to be translating it into various languages in the future. So I really encourage you to go to flippingstigma.com and take a look at it. Uh, it's separated into 3 different parts for people diagnosed, for care partners, and for professionals. And then within that are films, people diagnosed speaking, and it's just a really good, quite easy to use site. I highly recommend people take a look at it if they haven't already. Thanks.
Thanks, Lynn. That was really helpful background that I forgot to mention about the kind of global uptake that this toolkit has had. People have accessed it from all over the world, which is really exciting. And also, as Lynn said, there's different ways that this toolkit can be used. It's really easy to find at flippingstigma.com if any of you want to check it out later. So yeah, so that's how I thought I'd start by just kind of mentioning this project that was really actually transformational for me. Lynn, you mentioned how you really feel like this was an important project, but as a researcher for me, it kind of influenced the work that I want to do. And speaking of that, Lynn and I are going to talk about one of the projects that we actually did together, which is kind of loosely called the Dementia-Friendly Communities Action Plan, or that's how we're going to introduce it today. It has a fancy name in the proposal that we're not going to use. And this was a project that was funded by Alzheimer's BC, the Alzheimer's Society of BC, and Michael Smith Health Research BC. So that was wonderful to have that funding. And what's really neat about this project is that Lynn and I are co-leads. So that kind of speaks to the changing of the power dynamics in the sense that we applied for this together and planned it out. And Lynn was a really important part of this and continues to be as we share information about this study. So we're going to talk about a little bit about that today before we get to the audio diaries project. And you'll be hearing from both of us as we share a little bit with you about what we did, what we found out, and give a wee bit of information about the action plan that we developed together. And as you can probably guess, it was an action plan about dementia-friendly communities. And so you might ask, or many of you are likely familiar with that word, but for those of you who aren't, a dementia-friendly communities are we often use the term dementia-inclusive. These are communities where folks living with dementia, as well as the people in their lives, feel a part of the culture of the community. They feel included in all parts of and aspects of the community, and they are able to feel that they don't have to deal with the stigma that we know can come with a dementia diagnosis. So there's a lot of interest right now in the research and policy world and in different communities and organizations about how we can make our communities, so our neighborhoods, our organizations more dementia friendly so that people living with this condition can feel like they're a part of it. But what Lynn and I were wondering is, well, what would that look like, or what are the perspectives of people living with dementia who live independently? And we're going to explain in just a bit what we mean by live independently. But that's really where this project started out from. And I think, Lynn, I'm turning it over to you.
Yeah, we brought together an action plan of people living with dementia who also live on their own. This is what we mean when we say living independently. This was the preferred terminology based on conversations with people who lived on their own. Our overall goal was to work together to co-create and co-design an action plan to inform dementia-friendly community planning. This was our action group, and we consisted of 8 members, all of whom having lived experience various forms of dementia or neurocognitive challenges. They were all diagnosed, and they were all lived independently across BC from communities in the Lower Mainland, Vancouver, Northern BC, and the interior. And our plan was to bring the action group together with designers from the Health Design Lab at Emily Carr University of Art and Design in a series of workshops, at the end of which we would have co-designed our own action plan. We met and worked with the design team to plan out the first 3 co-design workshops. You can see how the health design team planned out a series of activities, and in the end, we decided on a collage and a tree building activity. In advance of the first workshop, we mailed out kits with the materials for the activities and the information about different activities we were going to do, as well as some teas, pens, and felts. All of our workshop occurred on Zoom, and they lasted about 90 minutes each. Mariko facilitated the workshops with one of the research assistants from the Health Design Lab. I participated in all the workshops. The first workshop focused on action group members and a research team member getting to know one another. Some of us created collages in advance of the workshops that we shared with the group, which focused on what the community means to us. And here you can see my collage, which at the time was what was happening in my life. You can see it was spring because I love daffodils, my favorite flower. I had just been to an Indigenous nurses celebration event. And because I am a proud member of the Métis Nation of BC, coming from Manitoba Saulteaux Nation roots. I also, you can see there, I've got an appointment for an electrocardiogram, and I've got my lymphedema band there. Us people diagnosed with various dementias, we don't just have, a lot of us don't just have dementias, we have other comorbidities happening along with our dementia problems also. You can see a plane ticket there. I was on my way. I had been in Ottawa for another research project, but more than Ottawa, I love to travel other places in the world. And I'm always like Mariko on the ferry across to Vancouver because I used to live there. I'm on Vancouver Island now. And the picture with family is also important to me. So with this collage, I was able to, and the other people with making their collages was a good icebreaker to get the group going. In workshop 2 and 3, we used laser cut wooden tree cutouts that we put together at home, and cards shaped like seeds, leaves, and flowers to add to the tree. On these cutouts, we wrote out things that ground us in the community, as well as what we value and hope in our communities in terms of what is inclusive and dementia friendly. Here's my tree. We shared our trees during the Zoom meeting, as well as what we wrote on the different shaped cards, and then sent in the pictures later. Some of my fellow action group members didn't put the trees together, but still fully participated in the activity. The tree simply served as a way to explore our idea about what we need in community as people living with dementia independently.
Along with all the action group members that participated, we had some research assistants taking part in those workshops. And what they did is they actually recorded notes on this really neat thing called a virtual whiteboard. And so you can see on the slide, I'm not sure if you can see my cursor, but there are these little blue sticky notes. And it's a little bit small. And that's okay, because really what we want you to get the gist of is that they were recording notes on these virtual sticky notes. And what they recorded on that was, what they were hearing from the action group members, the main ideas that were discussed, any observations that they had. And so eventually they had quite a large virtual board with all kinds of sticky notes of different colors, in fact, that represented each action group members. And between all of these workshops, they really, what they did was they synthesized. So that means they started reading through them and looking for main ideas and themes that were cutting across the workshops in terms of this idea of community that we were exploring and what was important for people who live independently and who also live with dementia when they talk about what community means to them and what helps them do well, live well in community. And so in workshops 4 and 5, what we did is we started bringing back these ideas and sort of initial themes that were coming out of the discussions and activities that we engaged in together in the first 3 workshops. And so the activities like the tree activity weren't meant to be just seen as an art collage or an exercise in, putting a neat tree together. It was a way to kind of work together because we were engaging in this work online, given that there were people coming in from different parts of the province. So we used it as a tool. But really what really mattered in this work were the discussions that we were having together. Each of the workshops were 90 minutes. I can't remember if we mentioned that or not. So we had a fair bit of time in each of these encounters to talk over the ideas that were important to the action group members. And we also got a lot of feedback, which again, the research assistants recorded. And you can see on the right side of the slide, these sort of gray larger notes. And this was, the main ideas that they were starting to record with some description of those ideas, and they brought those back. And what we got was interesting and, as I said, important feedback around not just the ideas we were exploring, but some of the language and terminology use that unfortunately, as people in the research world, we maybe relied on too much and needed to make the language more dementia friendly. So when we think about what a dementia friendly community is, there's all kinds of things that are important, including how we use language. And so we'll talk about that a little bit more in just a bit, but I just want to show you what we did in the final workshop. So by the time we got to this workshops, the times that we got together were usually every 2 to 3 weeks. So a couple months had gone by this point. And as we got towards the end, the research assistants and Lynn and myself, we had a plan drafted out based on all of the conversations and activities in those 5 workshops. And we shared it on the screen and listened to what the action group members had to say, changing things as we needed to, and finalizing the plan. And you can see our colleague and action group member, Mario, on the screen. He's we captured in the moment his process of giving some important feedback to all of us. I believe that in the resource document, there is a link that can take you to the full action plan, which is several pages actually, but we're just going to show you one screenshot from it today so that we're not overwhelming you with too much information. And this is what we call an infographic, or kind of like a picture that provides the main points of something that we want to get across. And so what we're trying to get across here is the dementia-friendly community action plan. And we use this idea of a tree kind of hearkening back to that activity we engaged in together to kind of give an idea of what a community is. So if you think of the roots or what ground a community in place, the trunk are the things that hold it in place, and the branches and the trees and flowers that might be on it are all the hopes and aspirations and needs that exist in a community. And what we learned from this process of partnering together and working closely with people with lived experience who live independently in community is that there were 2 really main important themes that they felt needed to be included in this action plan. The first is that people living independently with dementia need to be able to thrive in their communities. And in order to thrive, if you look at the flowers on this slide, they, first of all, need to have awareness and acceptance of what it means to live with dementia. We talked about that quite a bit because that can mean different things for everyone. And that's something we picked up on, as well as that, as many of you know, there is a wide diversity when it comes to the dementia experience. And people have to, in order to thrive, be comfortable with what their experience is. To thrive, folks also need to have to establish and be able to maintain a support system that meets their individual needs. So that could be quite different depending on a person's diagnosis, what's their own personal lived experiences in life, who they live with, or pardon me, where they live, what their needs are. And they also need to be involved in making their own decision making. And this was an interesting point that we discussed a lot with the action group members, because as researchers and I guess academics, we were using language like autonomy and decision making. And what we heard from the action group members, and they had to bring it up a few times, unfortunately, we kept missing that. And this is an important point to make, that it can take time to do this kind of work together, and it's really important to listen. But what we heard is the word autonomy didn't really resonate with them. And we needed to simplify the language in a way that was meaningful, because really what people need in order to thrive independently in community is to be involved in decision making. And if we go to the last flower on the screen, being physically and socially active was something that came out in our discussions a lot. The other important idea that came out of this is that there are specific things that need to be done in a dementia community. So if you look on the slide, this would be the trunk. So organizations need to recognize that they basically interface with people with dementia on a regular basis. They may not even know it, but they really need to be able to improve service delivery and ensure that the services they provide, whether that's in transit, in shopping centers and community centers, have a plan that really is dementia inclusive. Information and resources and education about dementia needs to be really accessible to members of the public. A lot of people probably have a lot of assumptions and understandings about dementia, and they don't actually know from a lived perspective what it means. And so we need to be able to provide that information to people in the community so that they in turn can be more dementia friendly in their interactions with others. We heard from the action group members that they need opportunities to be able to participate in daily life. And a lot of this was around being able to contribute and volunteer, to feel like they're a part of their communities in productive and meaningful ways. And that people living with dementia need to be able to connect with other people living with dementia. And so this project was a neat way that people actually became connected. So this is a very small snapshot of the action plan. In our plan, we actually go more into depth and pull out quotes from our meetings, from our workshops in it, to help illustrate it. So if you get a chance to have a look through it, or you're part of a community organization, feel free to share it with them in all of our joint efforts to make our communities more dementia friendly and inclusive. And I'll just turn it back to Lynn.
So our goal now is to share the plans with others in venues like this webinar. And Mariko and I also got the opportunity to present this project plan at the Canadian Association of Gerontology in Edmonton this past fall. Paulina, one of our research assistants, is also in this photo here. What we know is that when we share study information together, meaning that people with lived experience who were a part of the work are also a part of the sharing effort, it really makes a difference. I hope it was meaningful for you to hear from me today, from us today.
Thank you, Lynn. So that brings us to the end of the Dementia Friendly Communities project. And I just want to say, Lynn and I have done several presentations together, and I always really enjoy it a lot. So I'm so glad you were able to be here with you today, because I do agree with what you just said. It is more meaningful when there's someone with lived experience who's not only part of the project from the start, but part of the sharing too. It does make it more meaningful. I'm going to touch on another project that's coming out of my lab that Lynn wasn't a part of, but hopefully you'll find it interesting. And this is a project where I worked closely and collaborated with people with lived experience, but mostly with care partners, with their caregivers. And this project is, we like to call it the Storytelling and Audio Diaries project. And this one was funded by the Social Sciences and Humanities Research Council of Canada. And it's a project that took part mostly last year. It's just coming to an end. We actually have some exciting news about what's going to happen tomorrow, which I'll share with you in just a wee bit. But this project was took place because we know that, well, all of us know that there's an increasing prevalence of dementia all over the world, and certainly here in BC. And as people live with their dementia, there comes a time for not everyone, but for some that they really do need increasing support from the people in their lives. And often this is family members, but it could be friends, it could be neighbors. And what we call the people who provide this kind of care and support is we call them in our healthcare system informal caregivers. And we know that in the coming years, there's going to be a lot more people not only living with dementia, but a lot more people who are providing care, caregiving. And it's not always an easy thing to do, especially as dementia progresses and as things can become more challenging. And I certainly don't want to paint the brush of it always becoming more challenging, especially when we think about the first project that we talked about, where we were able to engage in really wonderful ways with people living with dementia. But as with any experience in life, there's different sides of the story. And so this project is really showing the story from caregivers of people who are living with fairly advanced dementia. So I just want to preface it with that. And so what our plan was for this particular project was to build on a previous one, which was called Call to Mind. And the Call to Mind project came out in 2022, so 3 years ago this January. And this was a project that occurred during the pandemic, where what the team that did that project did is they collected audio diary recordings from care partners, and used those to create a 4-part podcast series that showcased stories of caregiving as a way to raise awareness and empathy for the lived experience of dementia and for the lived experience of caregiving. And for the second stage of the project, I got involved with it. So the first project was undertaken by my colleague at UVic, Dr. Deborah Sheets, who's a professor emerita. So that means she's retired now. She just retired in 2024. And when I joined the university in 2023, she very generously asked if I wanted to take the lead on this project and if there was anything I wanted to do in terms of research, because the first project was really a knowledge translation project. So that just means they were developing knowledge to share, but didn't actually engage in some research. And so that's what we decided to do with this project, where we wanted to, again, ask people to create their own audio diary recordings. And I'll explain in just a bit what that actually means. But we wanted to explore and do some research into, what was that like for people? Is that helpful for them to record their thoughts and experiences using an audio diary format? And in this project, we also brought folks who took part in this project together. So it was mostly the care partners, but we did have people living with dementia join our groups. We had what we called supported storytelling groups, where we had usually about 4 people join in with myself and one of the research assistants that worked on this project. His name is Cole. And in those storytelling sessions, we asked the caregivers, the care partners, if they would be okay with sharing an excerpt from the recordings that they were making. And then together we explored what we were hearing about caregiving and living with dementia. And we actually recorded all those sessions and created transcripts. That became part of our data. And then I also did follow-up interviews with all of the folks who participated, and often with the people living with dementia as well, to kind of hear what they experienced from this project, what came out of it for them. And so that's what I'm going to talk about a little bit today. But before I do, I want to highlight again the first project, because you can listen to those episodes that came out in 2022 at the Call to Mind podcast.com website. And there's some really wonderful stories from different caregivers. You can see some pictures of them here, who have different types of caregiving relationships. And I do want to mention that in the second project that I'm going to be talking about today, we also created a podcast, which is coming out tomorrow, and I'm very excited about that. But to get back to our research project, what we had was 9 care partners and 7 people living with dementia who participated from across the province. So we had folks joining in from Vancouver Island and from the Lower Mainland and Fraser Valley, as well as the interior. So it was nice. We had representation from different sections of the province, and we also had folks who were a part of different types of caregiving relationships. So there were spousal relationships, parent-child. So we had, for example, a daughter who was who had her mom living with her, and they were together living this experience. We also had a daughter and her dad who similarly lived together. Um, 2 friends supporting one another, and a grandparent-grandchild relationship. And so that was really nice to really see the diversity of caregiving relationships, um, as well as different age differences, different stages of the dementia. Although, as I mentioned, most of the folks who participated who were living with dementia were fairly far along in the trajectory in their experience of living with this condition. So to just get back to about the audio diaries, in case you were wondering what the heck that means, what we asked is that all of the care partners download the Easy Voice Recorder app. So this is a free app that can go onto your phones or your tablets, and it's compatible with iPhones. Um, so I guess that's iOS systems and as well as with Android systems. So everyone could get this. And it's a really easy app to use where you can just hit play, and it's like writing in a paper diary, but you record your voice. And we didn't provide any parameters or restrictions in terms of what people could record. We simply said during the 3 months that we worked together, anytime you want to, and you feel the urge to record yourself, go ahead and use it. You can record moments together, you can record your reflections, we can record anything that you want. But we did ask them to send them to us. So we got lots of recordings emailed to us over the progress of this study. In fact, well over 100. And they were all very different in terms of how people did it. And there were times where the person living with dementia was a part of the recording as well. And people talked about all kinds of different things. And as I mentioned, we did have these supported storytelling sessions, which were very interesting because they became almost like peer-led support groups, where people provided advice to one another and importantly listened to what they were hearing um, when it came to other people's experiences of living with dementia. Um, And it also revealed the diversity, how different it could be depending on what was happening in people's lives. And yet there was always this thread that went through where people said, oh, I see myself in that. And that was actually really powerful. And what we discovered after doing all this work is that audio diary recordings offer actually quite interesting benefits. The people who participated really liked it, and some actually decided they would continue to record their own audio diaries for their own personal use. What we really heard, as I alluded to in the previous slide, is that it's really important for people to listen to others' experiences, and there's something really powerful that happens when someone feels heard in terms of sharing maybe some tough times or some joys that come in everyday life. And we also learned that there is some really nice benefits that come about when a small group of peers come together, listen to one another, share stories. Care partners and people living with dementia who participated talked about how needed proactive care and planning is when someone is living with a diagnosis of dementia. We heard that there's a real need for care that's and resources that are culturally sensitive. So, for example, there is a wonderful podcast episode where Ashley, a young woman living with her grandmother, so she is one of the caregivers for her grandmother. They live in a South Asian multi-generational family, and they've experienced a lot of issues when it comes to culturally relevant care. We also heard that that people living with dementia in the community, caregivers of people living with dementia in the community as well, need to feel better connected to other folks having similar experiences, and that the interventions and resources that are out there aren't always enough, and that we need to be a little bit more creative in thinking about how we can support those living with dementia and the people who are providing care to them as time goes on. So you can see our new Call to Mind podcast logo. So as I mentioned, we also developed a podcast series, and there are 4 episodes that are coming out tomorrow. So I'm really excited about that. And eventually we're going to also have a mini documentary, because we weren't able to use everyone's stories to create the 4-part episode of podcasts. And so we're going to use the remaining stories from the other people who participated, whose stories weren't included in the podcast series, to create what we're calling an audio documentary. So the different stories are melded together, and there's going to be some animation as part of that. And really what we wanted to do with these type of outputs. So if we think about the first project that we talked about, which was an action plan, this is a bit different, but it's a different way if you think about research knowledge of sharing findings. And so we're hopeful that this will raise awareness about living with dementia and the needs of people living with this diagnosis, as well as their care partners. And so that pretty much brings us to the end. I think we're kind of on time, so that's exciting. But we have some thoughts to end with, which really kind of bring us back to the beginning and some of the things that Lynn and I mentioned, which is that engaging with people with lived experience can and really should be at the core of planning and creativity and discovery when it comes to research. And that arts-based activities can support connection and actually can lead to discussion and sharing of research knowledge, if we think about the podcast series and the documentary that's going to be coming out. And we really feel that these projects were successful because of the practices that we put into place that centered around involving people in meaningful ways. And in order to do this, the research team, so myself and the folks who worked with me, had to be adaptive. We had to be flexible, and we had to meet people where their needs were. So that means that throughout these 2 projects, sometimes we had to adapt if someone couldn't join a meeting, for example. We had to maybe connect with them one-on-one. In the first project, in the Dementia Friendly project, there was one person who didn't feel comfortable joining Zoom, so I met with her in person. So there were, because she lived in Victoria and I could go and see her. So when there were ways that we could do that, we met people where they were at, and that's really important in this kind of work as well. And Lynn, I don't know if I can turn it over to you one last time to see if you had any thoughts that you wanted to share in terms of this kind of work, where we engage with people with lived experience.
Well, I think it's a win-win situation, because we can help researchers with their work and further knowledge in what we're looking at, but also us people diagnosed, we need to keep active. We need to keep our brains active to keep well. So that's why I say it's a win-win situation. It helps both of us. Yeah.
Thanks, Lynn. Yeah, I like how you put that. So I think we will end there. Thank you so much for joining. I really appreciate you taking time out of your day to listen to the 2 of us. If you have any questions, this is my email.
Thank you so much, Mariko and Lynn. What a fabulous presentation. I'm going to selfishly start with my own question for both of you. Uh, Given that you both have a background in nursing, I'm really curious to hear if exploring with arts-based methods challenged your beliefs or assumptions about what research could be.
Oh, that's a really good question, Carrie. Lynn, do you want to tackle that one? What do you think?
Well, I had worked with Emily Carr Institute before and been really impressed at how they can use art and creativity to come up with um, things that they want to talk about and to get people comfortable talking. So for me, for this project, I wasn't surprised because I had dealt with them before, and so it was nice. And seeing the other projects that are done at the Emily Carr Institute of Art, it's really fascinating, the diverse people that they help. Yeah.
Yeah, you're right, Lynn. They do all kinds of interesting work. And a lot of it, given that they're a health design lab and engage in design type activities, is really creative. Yeah, I really like that question, Carrie. And I guess I was thinking, as a nurse, it'd be interesting to hear what you think, Lynn, but in my practice as a nurse, you always have to be creative if you want to do a good job in being in your work as a nurse, because everybody is different, especially as a community health nurse where you're out there working in the community. So for those of you who might not be aware of that kind of nursing, that's what we sometimes call home care nursing, where I would go into people's home and provide care. You never know what's going to be the needs of the people there, and sometimes you have to communicate in really creative ways, or you have to come up with a plan that's maybe a bit creative that you might not be able to do in ways that you would in a hospital setting, for example. But even in settings like hospitals and clinics, when you work with human beings, you have to be open to doing things and in ways that meet people's needs when you're providing healthcare. So I think it was just sort of a natural evolution of my nursing practice to think about different ways of creating knowledge and also translating knowledge. Um, yeah, maybe that's how I'll
Yeah.
answer the question.
I
What do you
think for
think?
me too, because I was an emergency room nurse, and you never knew what you were going to be getting in, so you always had to be adapting and changing, and so yeah, I found it really easy to be able to use their platforms. Yeah.
Yeah. And certainly like you all might have likely picked up on the fact that this is qualitative research that we're talking about. So um, there is some really interesting arts-based research that's being done in the qualitative research field, where you can really use the arts as a way to explore people's experiences and understandings and really get at the root of their perspectives or their needs.
Thank you both for that. I think I'm gonna take away that nugget about looking at creativity like a transferable skill, that career-based creativity and sort of flipping it and working with it, especially um, with the fact that the the groups were held on Zoom. So having that arts-based activities to be able to sort of like bring you all together and into something that you're touching and working with at the same time is really, really interesting. Another question that we had, and I love the diversity of the projects as well. Um, a question that we have is, what have you learned from season one of the Call to Mind podcast, and how is that informing season two?
Oh, that's a good question. Um, oh, I wish I had Deborah here, who really led the first project and was the host of the first iteration of this project. I think what we learned is that something quite powerful happens when people share stories. And this was always important in my nursing practice, because when you listen to people, sometimes you could really get to the core of what their needs were, because sometimes a lot of is can be left unsaid. But when people feel open to sharing their stories, um, you can learn a lot more about what their needs are. And so what we did differently with the second project versus the first time around is that we did um, bring people together to explore this process of recording audio diaries, as I mentioned, and did learn that there was something useful in this process. We heard a lot from people who participated in the audio diaries project. So in particular, the care partners, is that they really felt listened to, and that was significant to them. It came up a lot in the interviews that to have to be heard makes a difference.
I
And
think there's so much interest in podcasts now, and they're sort of becoming a more recognized, and people are building some familiarity with it, so it's really exciting. And I know our team at the Alzheimer's Society of BC is eager to see and learn from this project as well, and just to see what the possibilities are.
Oh, that's good to hear. Yeah, the stories in the four-part episodes, I keep saying that wrong. The four-part podcast, that's right, are all different. So for example, there's a story from a caregiver whose mom had just moved into long-term care. So she was really exploring caregiving when you're not living with someone anymore, but that role and um, that sense of connectedness as a caregiver is still there. Um, and actually, as the podcast evolves, she loses her mom. Her mom passes during our project time together. And there's a story about a husband and wife where things have progressed and the decision to go on a wait list to a care home is made, and how they work through that. Um, there's also the story I was telling you about of that intergenerational South Asian family and how they experienced racism, but how they also were able to move forward as a family, and how the granddaughter, as a care partner, just rediscovers her role as granddaughter, because sometimes we lose roles and we take on other ones. And then there's a story of a large family. I think the story is titled "It Takes a Village," and really realizing that their privilege and how lucky they are to have a lot of resources and people surrounding them, and how that really makes a difference. And that's, useful knowledge in the sense that we know people need to feel supported, and when they do, outcomes and experiences can be much better. So it's a really positive story in that regard.
Marco and Lynn, I'll give you the floor one more time before we go into our sort of thank yous and little plugs.
Oh, thanks, Carrie. Such a nice job you did in hosting this webinar. I really, really appreciate it. I don't know, you've heard enough from me. Lynn, is there anything you wanted to add?
Yeah, no, I'm just glad that we would had this platform to be able to share our work, and yeah, it's going to be important because in the future there's going to be a lot more people diagnosed with dementia who are living independently. So I found it very important work that we're doing.
And just as a personal aside, I think it's so fabulous to hear about the Flipping Stigma toolkit being accepted into the WHO's, not the WHO's resource suite of dementia resources. That's a huge win. We're so proud. Yeah, we're so proud of our dementia research community, and another one of our colleagues in the chat was reflecting on how much she uses the Flipping Stigma toolkit. So we can't sing its praises highly enough. And we're really, that's such a resource that we're so proud of and really use a lot here at the Society as well. So thank you for continuing the reach. And I know translations are coming up. So looking forward to hearing about that.
Mhm. Yes,
Um,
yeah.
Thank you. And just a huge thank you, both Mariko and Lynn, for your collaborators as well. It takes a village to do great research, um, and for taking time out of your day to share these inspiring projects. And thank you to everyone who's tuned in, from both near and far. We always love to hear from you. If you have any questions or concerns about today's topic, please send us an email at research@alzheimerbc.org. We'll also share the link for a survey momentarily. Also, if you're wanting more information about dementia or wondering about programs and services offered through the Alzheimer's Society of BC, please give our First Link Dementia Helpline a call. Operators can support in English, Punjabi, Cantonese, and Mandarin. With that, I would like to extend a huge thank you again to Mariko and Lynn for sharing about the DFC Action Group and the Audio Diaries project, and to everyone who joined today. So take care.